Hello, I'm Dr. Herman. Welcome back to another great video here. This patient that I'm going to share with you suffers from rheumatoid arthritis. In another video, I shared about how she had amazing relief of acid reflux, bloating, and a chronic irritable bowel syndrome that she no longer suffers from. In this visit, her second visit with me, her second consult and examination, I went further in her body's tissues and studied what the other priorities are for her to start feeling relief from inflammation in her body and pain in the joints. And the first tissue that came up was her adrenal gland, the adrenal medulla in particular. And the second tissue that came up is her synovial fluid. The synovial fluid is located in all these joints. So those are the two tissues that we had to study and find what's causing the aggravation in those tissues. Now let me be clear. This patient already had the mercury fillings pulled out of her teeth before she ever set foot into my clinic. And this patient had already, as she tells me now, feeling the relief from the acid reflux and feeling the relief from the irritable bowel syndrome. I called it irritable bowel. I don't know if she was ever diagnosed with that, but she had multiple trips to the bathroom every day, 5 to 10 times in the morning. She had to make it to the bathroom. She was trapped in her home for a good part of her day because she couldn't leave because the bowels wouldn't stop. So if we can call that irritable bowel. But in any regard here, what I'm going to share with you is that even though the mercury was pulled out of her teeth, and she has shared with me that she did not feel relief from her chronic ailments, even though the mercury was pulled out of those teeth. She does tell me now, because she and her husband had come to my clinic a year before. This second exam was July 8th of 2015. She and her husband came to me over a year ago to find out about what I offer in my clinic to help people get well from chronic disease. And they decided that it wasn't the right time for them, for whatever reason. Now she's back, experiencing relief from acid reflux, experiencing relief from bloating, already experiencing in 2 weeks of starting the program with me, experiencing relief from a bowel disorder, a chronic terrible bowel disorder. She's already saying, I should have started back then. Well, oh well, my skills get better every day, so now is a better time than any before. In her adrenal medulla, which is very weak, wear and tear on that gland, I found 6 mercury compounds saturating the adrenal gland. Do you know that your adrenal gland's #1 job is to balance fluid in your body? Number 2 is dealing with inflammation. And number 3, the bonus of the adrenal gland is to help you have energy. And when it comes to energy of the human body, not always is the adrenal gland the #1 starting point to help people get rid of chronic fatigue. I'll talk about chronic fatigue in another video. I already have a set of videos out about that, but in particular, how we have to get inside the red blood cell and how we have to get into the hemoglobin of the red blood cell to help relieve the chronic fatigue and the brain fog that people suffer. In any regard, 6 different mercury compounds still saturating her adrenal gland, causing inflammation, causing fluid imbalances in the body, causing stress to all tissues, brain, heart, nerves, joints, all included. We found dental amalgam. I found silver mercury compound, a dimethyl mercury compound, multiple copper amalgam and thimerosal mercury compounds, and other just harmful multiple mercury dimethyl and methyl blends of mercury in that adrenal gland. I also found a mycoplasma, a very high level of mycoplasma infection in that adrenal gland. I found multiple antibiotic residues saturating that adrenal gland, causing it to malfunction, causing decrease of energy, causing more inflammation in her body. Multiple substances, foreign substances like food additives and preservatives and pesticides and herbicides saturating the adrenal gland. She's following a protocol for the next 3 weeks, which will start removing immediately without any foreign synthetic chelating chemicals to remove those mercuries from the adrenal gland in particular, focusing only on that adrenal gland to get that mercury out of there. Not out of the whole body, The body's not ready for all of that yet. We have to be step by step to remove the mercuries that we're finding in those tissues of the adrenal gland first. Second system of her body, second tissues in her body that need help is the synovial fluid, which is located in all of her joints. That synovial fluid, inflamed, we see these little these spur formations on the fingers. There are these balls, they look like, of calcified balls that under the skin that just swell up in these joints of the fingers with RA. She's on medication, which is not doing a world of good for her with decreasing the inflammation or stopping the progression of the rheumatoid arthritis in these joints. And what I found with her synovial fluid is that she's got a very high level of Lyme, Borrelia, Burgdorferi infection. She's got multiple parasitic infections. She's got Babesia infection in those joints. How can a person's joints experiencing relief from inflammation in the joint, how can a doctor stop the progressive degenerative arthritic disease by providing prednisone or providing Plaquenil or methotrexate or any of these autoimmune immune suppressing medications when they leave the infection in the tissue? It just doesn't make sense. For me, I come from a different school of thought. If somebody's on that medication, we can't take them off of that right away. And I understand it may help to decrease some of their pain, but you've got to get rid of the cause of the chronic inflammatory condition. Your body doesn't attack itself. Your body doesn't get inflamed for no reason. There are causes of inflammation in your body that your doctors have not discovered. It's not just food sensitivities. There are infections that can be in your joints, in your tissues, causing the chronic inflammatory breakdown, causing the chronic degenerative condition. So she's on a protocol for the next 3 weeks to get these mercuries out of the adrenal gland, to get the infection out of the adrenal gland, to get the toxins and the antibiotic residues out of the adrenal gland, to get these multiple infections, parasites and Lyme infection out of her synovial fluid. I will recheck her adrenal medulla on the next visit, which is in 3 weeks. I will recheck her synovial fluid on her next visit in 3 weeks to see if both of these tissues have been cleared of all infection and toxin. Sometimes the body has the ability to remove 4 of, let's say, 10 infections that are in the synovial fluid, and only those 4 can be dealt with in this visit, and the other 6 will be in the next visit. Sometimes that's just the way that the body works. So we have to listen to your body and follow a very unique, individualized, step-by-step protocol that's going to help you find out what's causing your problem, eliminate those causes, and help your body settle down. And that is what can be done for you. Again, my name is Dr. Herman. I want to thank you for listening to this video. I look forward to helping you. I'll share more about this patient as she comes back for her next visits. And I'll be in touch here. Always subscribe on my YouTube channel. Come over to my Facebook page. Call my office so you can arrange your first step towards your health recovery. 954-370-3100.